Alas 4 na ng umaga, madaling araw. Mga nurses out there, first time kong kumain ng maayos, I need to put my feet up. I still have that pain. Bakit parang ang laki ko sa angulo na to, ha? Why do I even care? Basta busy ako. Sobrang okray ang shift ni Nurse Rebecca today. So this is my food. Alam niyo kung anong ulam ko? Itlog. Kaya tayo na itlog today. Well, anywho, I'm really hungry right now. I started my lunch already. First time kong umihi. Hindi ako nakainom ng tubig, pero nagkape ako. It's a must. So I've been drinking coffee. I'm so glad. I have a really good team. I only have 4. Actually, I started with 3 patients. Pagpasok ko pa lang, meron ng social issues yung patient. Itong pasyente na to has been throwing up the whole day. Okay, so yung nurse niya nung pag-umaga, Tagalogin natin. Yung nurse niya nung pag-umaga has been calling the doctor na may pain yung pasyente, tapos nagsusuka. Ang akala ng doctor, siguro dahil hindi na-specify, ang pain is from surgery because ang pasyenteng ito ay may amputation ng right leg. Merong abdominal surgery at saka meron siyang donor site sa left leg. So all along, ang akala ng doctor is ang pain is galing doon sa surgical site. Tapos nagsusuka because yung pagsusuka, he's been having on and off nausea and vomiting since he's here. So lagi siyang may Zofran PRN, lagi siyang may Phenergan PRN. So ngayong gabi, si Nurse Rebecca ang nurse ng patient na to. So nung sinabi kong yung patient is in pain, saan ang pain mo? Sabi niya dito, masakit. Sabi ko, okay. Tapos nagsusuka siya. Ang suka niya was greenish. Anything that you give him, nilalabas niya. Okay, so I have to specify na ang pain is sa abdomen, hindi sa surgical site. Oh, so napaisip yung doctor, okay. Let's do a KUB. So they did an x-ray of the KUB. Thumbs up. Ang patient, merong ileus. So, anong order? Keep the patient NPO, insert NG2, start IV fluids. Okay, so we did that already. Tapos, before that, I was able to get an IV Dilaudid. Actually, this patient, they're trying to send him to a skilled nursing facility na. Dapat bukas na January 26, but they can't. Oh, and part of that, if future USRNs, pagpunta nyo dito, let's say may patient kayong supposed to go to a skilled nursing facility, ayaw ng skilled nursing facility na yung patient ninyo is on IV pain medicine in the last 24 hours. That's why they've been tapering his pain medicine. This patient has been here since December, basta over a month na siya dito, okay? From a motor vehicular accident. Well, anyway, okay na yung wounds niya but all along, nagde-develop siya ng mga ibang sakit. So, ngayon nga, may ileus siya. Nasaan na ba tayo? Ayun nga, dapat pupunta na siya sa SNF. So, ayaw nilang bigyan ng pain medicine. So, sabi niya, just give him his PO Dilaudid. Nagsusuka nga Okay, so hindi niya tolerated. So the doctor was very kind to give me an IV pain medicine. So I gave him the Dilaudid 2 milligrams IV before I inserted the NG. And true enough, as soon as nung gumanon, bumulusok yung output, 300 greenish output. And after, siguro wala pang 10 minutes, naging 700. And because that's the continuous. Kasi in-insert ko, syempre, kailangan continuous. And then, it has to be, change namin sa low intermittent wall suctions. And when you say low intermittent, dapat 80 and below ang pressure. Okay? At saka pagpunta dito, meron yan. Alam nyo na yan. Well, anywho, yun yung, because the doctor will not order kung ano yung pressure. They will only order yung LIWS, which stands for low intermittent wall suction. Okay, so after the Dilaudid, after I inserted the NG, the uncle was at bedside, the aunt was at bedside. They thought magician si Nurse Rebecca because after that, the patient fell asleep and the patient was able to verbalize that his pain from 10 went down to 5/10. Okay, so he fell asleep a little bit. After a while, mga 2300, he woke up and tawag dito? He's asking for a sleeping medication. So the doctor ordered melatonin, but he refused it. And then he started to have another episode of pain. This time is 10/10 again. So the doctor actually ordered labs for him also, a CMP. What's the difference between BMP and CMP? Ang CMP meron siyang liver enzymes na kasama. The BMP regular meron lang ng renal function and your ano tawag dyan, some electrolytes, but with CMP, complete metabolic panel. The BMP is, ano na nga, ibig sabihin ng B? Basic metabolic panel, BMP. And CMP is complete metabolic panel. Meron siyang liver enzymes na kasali. So we did that. It turned out that his liver enzymes are a little elevated. His WBC is elevated. And so now we are doing a CT abdomen. The doctor ordered that, so he needs to go to CT scan, and the doctor resumed his IV Dilaudid. Kasi the times 1 IV Dilaudid I gave him before the IV insertion was only ordered times 1. So the doctor reordered his Dilaudid. It's 1 milligram Q2 hours PRN as needed for pain. So I gave him that. Now, we're waiting for CT. They just called me. Sa habang kumakain ako, tumawag, "Hey, Rebecca." Nag-report ako. Sabi, "Hey, Rebecca, CT is calling. They're looking for you. Can you please just tell them the patient is ready?" Sabi ko dun sa nurse na pinagbigyan ko ng patient. "Can you please tell them the patient is ready and he has a PICC line and stretcher is okay?" "No, they want to talk to you." Pagpunta ko sa phone, okay, fine. I have to stop eating. I have to go there. I said, "Hey, this is CT scan." Sabi ko na nga ba, yun ang tatanungin. "Is the patient ready? Yes. Does he have a good IV site?" Yes. Because they're going to use an IV contrast. So, at 20 gauge ang kailangan. If your IV is in the hand and kahit 20 gauge yan, ayaw tanggapin ng CT scan yan. It has to be higher. But depende sa policy and protocol ng CT scan unit ninyo. Pero sa amin, kapag ang IV mo ay 22 gauge, ayaw nilang tanggapin yan. But our patient, this patient has a PICC line, so he should be okay. So that's on top of that. So kanina nung nagsusuka, well, all this chaos is going on. I have another patient that's complaining of chest pain, and it's a left-sided pain. He looks comfortable. Vitals are okay. O2 is also okay, but he just came from dialysis. His pain, he said, was 8/10. He said it's a pressure pain. Not the problem with this patient is he is not a burn patient. Burn was consulted, so nagtuturuan ngayon. You will meet doctors like that, nagtuturuan. Sabi nung burn, call the primary, which is the medicine doctor. The medicine doctor never called me back hanggang sa yung chest pain ng patient ay naging 3/10 at naging 0 na lang yung pain. Well, anyway, this is an ESRD patient. He's okay. Okay, and the other one, and then I admitted another patient, which is, oh my God, it's an ATV accident. Meron siyang, dito, sugat, namamaga yung mata niya, tapos may talagang wak-wak yung arm. So we have to do the dressing change. Good thing meron akong isang patient who's here for an autograph of the right arm. He is the best patient in the world. Kawawa naman, pasilip-silip na lang ako dun sa room niya because he's sleeping. He's actually okay. No pain. So every time I go there, he just said, no pain. Kasi magka-roommate yun eh. Itong suka ng suka and my other patient. Well, anywho, it's exactly 4 o'clock in the morning now. Exactly ba? From my angle, it looks like it's exactly 4 o'clock in the morning now. So, I have my timer on. Pag nag-on yung timer natin, tapos na ang break ni Nurse Rebecca. So, yun lang. May 30-minute break. Hindi ako papayag na hindi ako mag-break. Well, this is our content today. At least may nai-content si Nurse Rebecca. And I'll be off today na. Off na ako today. Hi, salamat. May tataas ko na yung pako. Thank you so much guys for always watching Pinoy Nurse Portal. Marami akong reels na ilalabas. At saka kung may mga tanong kayo, minsan if I say something that doesn't make sense, it's because one, I'm old, two, I'm bangag, and saka madaling araw na po. Maraming salamat sa inyong lahat sa panonood.